Hi everyone, I'm Jeremy Henderson Tilak Singh. I'm the principal at Indigo Path Collective, where I'm a licensed professional counselor and a mental health service provider, a leadership coach, and an employee engagement and corporate wellness consultant. This brief overview training should take about 10 minutes, but feel free to take breaks and come back as you need to. At the end of this presentation, we'll invite you to submit questions should you wish to continue the conversation. Welcome to our innovative webinar focused on creating LGBTGEQIAP plus trauma-informed acute care. Before we jump right into the agenda, however, I'd like you to meet Spencer. Spencer just showed up in your acute care department. Spencer was violently attacked outside of your local Walmart and presents with cuts and scrapes, but the wounds are considered superficial. However, Spencer is showing signs of a concussion, which is evidenced by a report of an extreme headache, dizziness when Spencer tries to stand up, and little to no ability to tell you how Spencer was transported to your department. So, you know what happened to Spencer and the reason for Spencer being kept overnight, but what do you really know about Spencer? If your acute care environment is like the vast majority of acute care environments, you probably don't know much about Spencer. So, let's take a moment to introduce you. Spencer is a 25-year-old African American transgender male. Spencer uses he, him pronouns, is married, and identifies as heterosexual. Importantly, English is his preferred language. And you might be asking, why is any of this important? It's important because knowing Spencer can help you make better clinical decisions, trauma informed decisions about how to care for Spencer. Here are a few examples. Spencer's preferred language is English. So if you speak English to Spencer and he is confused, you have more evidence that he is likely experiencing a concussion. But you might not realize that Spencer just experienced a hate crime. A neo-Nazi group targeted him for being transgender and African American. Gathering this evidence can further help you to decide exactly how to ensure Spencer gets the best possible care from you and your team. So let's do just that. Let's talk about LGBTGEQIAP plus trauma-informed acute care. During this training, we'll explore trauma, trauma-informed care, and LGBTGEQIAP plus acute care. If you are ready to get started, I invite you to take a seat. Let's talk. Trauma is defined as a harmful event, a threat to one's life, or discriminatory structures that impair one's mental, physical, and social and spiritual functioning. Trauma survivors are often seen as visitors in acute care settings, so implementing trauma informed principles is crucial to their health. The good news is that key strategies are already identified to guide your trauma informed practice in acute care settings. The Centers for Disease Control and Prevention provide trauma informed guidelines that specifically include safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. However, while these key strategies are vital, please note that anti racist and anti discriminatory practices remain disconnected from most trauma informed care practices. Historically, LGBTGEQIAP plus patients are met with hostility in healthcare settings. The acute care needs of the LGBTGEQIAP plus community are incredibly diverse and inclusive of all races and ethnicities, sexes assigned at birth, gender identities, sexual orientations, religions and spiritual orientations, disabilities, education levels, socioeconomic statuses, and more. To that end, the traumatic experiences of this population are likely inclusive of the most common in acute care settings. Thus, standardizing trauma informed acute care practices based on this population can position trauma informed care as a driver of acute care quality while encouraging trauma survivors to seek care, reduce traumatization, promote empowerment, and eradicate some aspects of secondary trauma associated with the discrimination and oppression experienced by this population. So the natural question then is, how do we do that? We suggest first defining the program. So what are you going to do? Then you implement the system. How will you manage the program, in other words? You provide training. So what you will teach your teams to use and in terms of the program and the system. And communicate effectively, not just the language you will use, but how you will send and receive information about the patient and their family members. Trauma-informed care environments benefit from integrated health approaches that promote safety and empowerment. Be inclusive by creating a welcoming space and signaling acceptance by posting LGBTGEQIAP+ symbols. Consider avoiding religious references because of the often negative impact of religious institutions on this population. Establishing such an environment, coupled with culturally competent providers, can improve trust and care equality. Knowing the language associated with the LGBTGEQIAP+ culture is important. Avoid making assumptions about the LGBTGEQIAP+ population and know the common challenges this population faces, such as difficulty talking about sex-related health issues, gender identity, gender-affirming surgeries, hormone use, or substance misuse. For any program to be successful, implementing systems to manage the program is required. One system example that is frequently used in acute care settings is intake paperwork. Providing LGBTGEQIAP+ culturally aligned registration forms and intake paperwork can convey acceptance, openness, and inclusivity. Create structures that reinforce confidentiality in collecting and maintaining LGBTGEQIAP+ patient information and data. When moved into treatment, LGBTGEQIAP+ affirming accommodations are recommended, such as pairing a patient with another patient who shares their gender identity or ensuring access to restrooms consistent with the patient's gender identity. Partner the patient with an unbiased healthcare provider and be well aware of the risk of patient-to-patient violence. Discharge is the final aspect of a well-designed trauma-informed plan. Finally, engage a system that supports the patient when they leave the acute care setting with affirming resources and referrals to external partners when needed. Train everyone on the team to understand the program and use the system. Training topics for acute settings that deliver LGBTGEQIAP+ trauma-informed care can include minority stress, physical exams, history taking, intimate partner violence, trauma screening, transgender healthcare, healthcare discrimination, stigma, preferred names and pronouns, and more. Training can be delivered via lectures, simulations, online learning, workshops. These are just a few of the opportunities that you have for training. Now, effective communication promotes partnership, engagement, healing, empowerment, and health outcomes. So pay attention on purpose to not only what you are saying, but how you are saying it. Understand and appropriately use language, which includes avoiding derogatory terms, using preferred pronouns and names, and following the patient's lead to establish terms, which can be noted in the patient's medical record for other providers. You can also leave any discriminatory religious views you hold at the door so you can focus on helping the patient heal without re-traumatization. Finally, it is crucial to measure and report your program outcomes. You could implement a patient net promoter score, monitor employee turnover and cost savings, and even track LGBTGEQIAP+ recommendations from community members and partners. Measuring return on investment is always recommended for the leadership team. So let's take a moment and look back at Spencer's situation one last time to test your knowledge. So here's a question. Can trauma-informed acute care designed to treat the LGBTGEQIAP+ population be an opportunity for Spencer to receive effective care? Yes. Should your system support Spencer's experience in acute care? Yes. Will training your team result in Spencer feeling seen, heard, understood, valued, and validated in your acute care setting? Yes. So great work. It looks like you got the important parts. So we've come to the end of our recorded training. Thank you for joining me in exploring the LGBTGEQIAP+ trauma-informed acute care. If you would like to get in touch to ask a question, feel free to email me at jeremy@indigopathcollective or check out our website at indigopathcollective.com. There you'll also find on our blog additional resources.